Welcome to ClearPath NCLEX, your clear path to nursing success. In our last video, we covered everything you need to know about calcium. So today, we're moving on to another incredibly important electrolyte, and that is magnesium. If you think of calcium as the spark that makes muscles go, then magnesium is the peacekeeper that keeps everything calm and running smoothly. So let's get into it.
Okay, here's a quick look at our game plan. First, we'll talk about magnesium's main job as the body's peacekeeper. Then we'll dive into what happens when things get chaotic with low magnesium or hypomagnesemia, and then what happens when they get too calm with high magnesium, hypermagnesemia. After that, we'll touch on some special uses for magnesium sulfate, cover some really key safety points, and then of course we'll wrap it all up with some practice questions to make sure you've got this down.
All right, let's start from the top. What exactly is magnesium, and why is it so important for our patients?
I love this analogy. Think of magnesium as the sheriff for your muscles. Its main job is to keep law and order. You see, it acts as a natural calcium blocker. It kind of stands at the doorway of the muscle cells and says, "Whoa there, calcium, not too much of you gets in." This is what prevents our muscles from getting all twitchy and overexcited. It maintains a nice, controlled state of relaxation.
And you can see here, its job goes way beyond just muscles. I mean, look at this list. It's crucial for keeping our heart in a stable rhythm, helping our nerves send signals properly, and it's even needed to make ATP, which is the basic energy for all our cells. Plus, it helps manage calcium and potassium levels and is needed for vitamin D absorption. It's a real multitasker in the body. Now, this is a number you absolutely have to memorize for the NCLEX. The normal range for magnesium is super narrow, just 1.5 to 2.5. Because this window is so tight, even a tiny little shift up or down can cause some really serious problems for your patient. So, what happens when the sheriff isn't on duty? Well, you get hypomagnesemia. This is a state where the body just descends into total chaos. Let's take a look at what that means.
So, clinically, we're talking about a magnesium level that drops below 1.3. Without that sheriff keeping things in check, there's no law and order. The muscles just get way too excited and start firing off signals uncontrollably. It's a state of dangerous hyperexcitability. For the causes, here's the handy little mnemonic to remember. CRE. C is for chronic alcoholism, which is a huge risk factor. R stands for really large fluid loss. Think severe diarrhea or Ng suctioning that just pulls magnesium right out of the body. A is for certain antibiotics. And Y? Well, the Y can help you think of why someone might be malnourished, like with pancreatitis, or other absorption issues.
And when you look at the signs, it's all about everything being overstimulated or buck wild. The heart starts racing with tachycardia and can even go into deadly rhythms like torsades de pointes, that twisting pattern on an ECG. Neurologically, you can see seizures, and for muscles, we get hyperactive deep tendon reflexes, tremors, and even tetanus. Okay, so how do we manage this? Just remember the mnemonic SIM. S is for safety. First thing you do is get seizure and aspiration precautions in place. I is for IV magnesium sulfate, and the key word here is slowly. You have to give it slow or you risk pushing them into hypermagnesemia. And M is for monitor. You're going to be watching their heart rhythm, their breathing, and their reflexes like a hawk. All right, let's flip the script. What if the sheriff is a little too strict and enforces way too much calm? Well, that's when we get hypermagnesemia, a state of just excessive sedation. Hypermagnesemia is when that magnesium level climbs above 2.1. In this case, the body becomes way too calm, too quiet, too suppressed. It's like the entire body system has been sedated. The mnemonic DARK can help you with the causes here. D is for DKA. A is for antacids and laxatives that have magnesium in them. This is a really common one. R is for renal failure, probably the most common cause, because if the kidneys aren't working, they can't get rid of the extra magnesium. And K can remind you of potassium excess, which you might see in Addison's disease.
So the signs of high magnesium are the exact opposite of what we just talked about. Everything slows way down. The heart rate drops, causing bradycardia and hypotension. Breathing gets shallow, leading to respiratory depression. The patient gets drowsy, lethargic. And the classic telltale sign is that profound muscle weakness with decreased or even totally absent deep tendon reflexes.
For interventions, think HIM. First and foremost, you stop any magnesium they're getting. I is for IV calcium gluconate. This is the antidote, and that's a huge NCLEX point. H is for hemodialysis if things get really severe, to literally pull the magnesium out of their blood, and M, once again, is for constant monitoring of their vitals, ECG, and of course, their reflexes.
This is a great little summary slide.
It just puts everything side by side. Low magnesium is hyper and buck wild. High magnesium is slow and too calm. As you can see, they're really just mirror images of each other. Once you understand one, you can pretty much figure out the other.
Okay, now let's talk about some real-world applications. Magnesium sulfate isn't just for fixing low levels. It has a couple of very specific, high-yield uses that you are almost guaranteed to see on the NCLEX.
The two big ones are preeclampsia and torsades de pointes. In a patient with severe preeclampsia, we give magnesium to relax the central nervous system and prevent them from having a seizure. And for torsades de pointes, magnesium is the go-to first-line drug to stabilize the heart and stop that dangerous rhythm.
Now, if your patient is on a magnesium drip, your monitoring has to be top-notch. You're watching their respiratory rate, their urine output, and especially their deep tendon reflexes. If any of these start to drop, especially if those reflexes disappear, that's a huge red flag for toxicity, and you need to act immediately.
Let's do a quick fire round of the most important safety points and some easy ways to remember all this for your exam.
Number one, and this is a big one, always check kidney function. The kidneys are what clear magnesium from the body. So if your patient has any kind of renal problem, they are at a super high risk for becoming toxic really fast.
Your best friend when monitoring for magnesium toxicity is your reflex hammer. A decrease in deep tendon reflexes, or them disappearing altogether, is one of the very first signs that your patient's magnesium level is getting too high.
And finally, you have to know the antidote. It's calcium gluconate. It works by directly opposing the effects of magnesium. If you are ever giving a patient IV magnesium, you need to know where the calcium gluconate is and have it right there ready to go.
All right, here are some super simple tricks to lock this in. Low mag equals hyperreflexes. High mag equals no reflexes. And if you remember anything, remember the 3 M's: magnesium, mellows, muscles.
Okay, you've got the knowledge. Now let's see how you do with a few NCLEX-style questions. Here's the first one. Your patient is getting IV magnesium for severe preeclampsia. Which one of these findings means you need to do something right now? Take a second to look at the options. The correct answer is number 2. Absent deep tendon reflexes. That's a classic early sign of magnesium toxicity. All the other options are stable and pretty much within normal limits.
Okay, question number 2. A patient who is a chronic alcoholic comes in with tremors and hyperactive reflexes. What electrolyte imbalance are you thinking of? The answer is number 3, hypomagnesemia. The history of chronic alcoholism is a huge clue, and all those signs of neuromuscular excitability, the tremors, the hyperreflexia, they all point directly to low magnesium.
And our last question. When you're giving the antidote, calcium gluconate, for high magnesium, what is your number 1 priority?
The priority here is number 3. While calcium is the right antidote, giving it can cause its own heart problems, especially severe bradycardia. So putting that patient on a continuous cardiac monitor is absolutely essential for their safety.
And that's a wrap on magnesium. If you found this video helpful, please go ahead and like, share, and subscribe to ClearPath NCLEX for more high-yield content to help you crush your exam.